Hello, my name is Erick Perez, and we're going to be doing a head-to-toe assessment today. This is Irán Martinez, and we're going to start. First, I'm going to start off by washing my hands for 15 to 20 seconds, come into the room, introduce myself. My name is Erick. I'm going to be your nurse for today. If I may, can I please confirm your identity? What's your first and last name?
Irán Martinez,
Your date of birth?
1999.
Okay, Mr. Martinez. Today we're going to be doing a head-to-toe assessment. Is it okay if we start? Okay, we're going to start off with the head. First thing I'm going to do is I'm going to inspect for symmetry. Can you smile and raise your eyebrows? Okay, no signs of facial asymmetry. Next thing I want to go ahead and do is I'm going to palpate. I'm going to start off with the temporal artery. 2+ inbounding, which is normal. I'll go ahead and start with the temporal mandibular joint. Open and close for me. Good. I'll palpate for any signs of masses or nodules. No signs of abnormalities in that sort. The next thing I want to do, can you please clench your teeth? Blow up your cheeks? Raise your eyebrows? Good. So those seems to be intact. The next thing I want to go ahead and move on to is I'm going to go ahead and move on to assessing his eyes. We're going to go ahead and check for pupil size and reaction to light first. Okay, pupils are 3 and brisk and reactive to light. The next thing I want to do is check for extraocular movements. Just follow my finger, please, without moving your head. Okay, so extraocular movements are intact. The next thing I want to go ahead and do is I'm going to go ahead and use my ophthalmoscope to check out any anatomy of the eye, starting with checking for the retina. No signs of retina detachments, no signs of macular degeneration, no signs of artery abnormalities. Everything seems to be intact. Over here, you have no signs of blurriness, correct? Loss of vision. Optic nerve is intact. No signs of abnormalities on either side. Okay? After assessing the eyes, we're going to go ahead and move on to assessing the ears with a ear speculum. We'll check for the tympanic membrane. It seems normal, no signs of redness or inflammation, no signs of discharge or rupture. Both are bilaterally okay. Next, we'll do nasal. We'll go ahead and check for nasal symmetry or septal deviation. The turbinates are normal size. We'll go ahead and move on to the mouth. Can you please open your mouth for me? The palate and uvula are pink. Uvula is midline. Tongue, can you please take out your tongue? Tongue, no signs of tongue deviations. Tongue is pink. Gums are pink, no signs of bleeding. Teeth are intact, no signs of missing teeth. The next thing I want to go ahead and do is I'm going to go ahead and palpate for lymph nodes in the head region, starting with the preauricular, postauricular, occipital, tonsillar, submandibular, mental, anterior cervical, posterior cervical, supraclavicular, and there's no signs of enlargement or any abnormalities in that aspect. I'll go ahead and move on to palpating for the thyroid gland, anteriorly, posteriorly, right and left of the patient. No signs of enlargement, no signs of masses. And we'll also go ahead and move on to palpating the carotid artery. Pulse is good. We'll go ahead and move on to auscultating it. The bell of my stethoscope. And it's intact. Okay? So everything seems to be intact so far. Next thing we want to go ahead and move on to is the cardiovascular system. Starting off with pulses. We'll go ahead and check pulses. Okay, radial pulse is 2+. Bilaterally, we'll go ahead and move on to dorsalis pedis. Bilaterally, 2+. Post-tibial pulses, bilaterally, 2+. Next, we'll move on to the auscultation of the heart sounds, starting off with the right side, if I may. The right side, second intercostal space, aortic, directly to the other side. Pulmonic, one intercostal space down is the herbs. So on tricuspid and mitral, using both the diaphragm and the bell. And we are able to note that there are no signs of murmurs, and the best regions to listen to the S1 heart sound is in the tricuspid and mitral region, and the S2 sounds are best heard in the aortic and pulmonic regions. Okay? After assessing cardiovascularly, we're going to go ahead and move on to chest and lungs. Chest and lungs, we're going to go ahead and listen to the patient anteriorly, posteriorly, and laterally, and also check for CVA tenderness. So we'll auscultate. It's best if the patient sits up for this. Oh, it's okay. Take a deep breath. Working our way down in zigzags. This is the anterior portion. Good. Everything seems to be clear. We'll move on to the lateral portion. Good. We'll check the posterior sounds. Everything seems to be clear. And we'll check for CVA tenderness. Any signs of tenderness? Good. Everything seems to be intact. Everything seems to be intact. All breath sounds are clear. There's no sounds of adventitious. And we can go ahead and move on to abdominal. In the abdominal side, I'm going to be standing on the right side of the patient as we have been. And we're going to ask the patient to lay down on a 30 to 45 degree angle as we listen to some abdomen sounds and whatnot. It's best to start with auscultation. We'll start at the right upper and work our way around in a circle. Bowel sounds are normal active, no signs of hyperactive or hypoactive activity. We'll go ahead and move on to auscultating vascular system with the aorta. Work our way bilaterally left and right with renal regions. The iliac and the femoral. Everything seems to be intact. Blood flow seems normal. The next thing we want to go ahead and do is percuss. We're percussed all regions. Left side is the spleen, left upper quadrant. Right upper quadrant is the liver, which is usually heard dull. Seems to be intact. We'll then move on to palpation, light and deep. Palpating the aorta in the middle, liver, midclavicular line, the border of the liver, left upper for the spleen. Everything seems to be soft and normal, which is a good sign. No signs of rigidness, no signs of pain, correct? No signs of rebound tenderness, which is good. Usually the right lower quadrant, some people experience pain for appendicitis, but we're good. The next thing we're going to go ahead and do is we're going to go ahead and move on to neurological. Neurologically, we'll go ahead and start by testing the patient's strengths. Can you please move against my hand? Other side? Good. Okay. Can you shrug for me? Okay, good. Now, I'm going to go ahead and check for coordination. Good. Can you go ahead and touch your nose and then my finger? Good. Can you touch your heel and work your way down on both sides bilaterally? Good. Okay. After that, we're going to go ahead and check for vibration and position of the great toe using a tuning fork first. Do you feel that?
Yeah.
Do you feel that?
Yeah.
Good. Okay. So sensation and coordination are intact. Next thing you want to do is test his visual fields. Without, just look at me directly. How many fingers?
2.
Without looking at the fingers, look at me.
1, 2, 1.
Other side.
3, 1, 2.
Okay, good. Visual fields are intact. Next thing I want to go ahead and do is we're going to go ahead and test the patient's ability to balance using the Romberg's test. Can you please stand up for me? Stand on 1 foot. Close your eyes. Other side. Good. So he has a negative Romberg's test, which is a good sign. You can sit down for a sec. Which is a good sign because that's usually a sign of a neurological abnormality. The next thing we want to go ahead and do is ask the patient to walk across the room and back in a heel-to-toe pattern to check his gait. Gait is normal. Come back down. Perfect. Everything seems to be intact with this patient. The next thing we're going to go ahead and do is wash our hands for 15 to 20 seconds. Mr. Irán Martinez, we have concluded our assessment. Is there anything else I could do for you? Okay, perfect.